Right now, LifeStream Blood Bank says it is unable to fill 90% of hospital blood orders. Doctors say it's alarming, and the shortage has already delayed certain surgeries. I spoke today with the Chief Medical Officer for Eisenhower Health, Dr. Alan Williamson. Dr. Williamson, first off, how concerning is the blood shortage for you, and what does this mean for Valley hospitals?
Again, Peter, thank you for having me. It is very concerning. There is really no substitute for human blood, no effective substitute for that at this point. So there are times where we really have no other avenue for treating patients, trauma patients, patients with bleeding ulcers and other issues, having major surgery where there's blood loss involved. We have to have blood available in order to be able to provide that level of care. And it has become increasingly problematic over the years with some restrictions that have been placed on the blood supply for safety reasons and so on. And perhaps just a little bit less interest on the part of the public to be donating blood. But for whatever reason, we've, over the past several years, just progressively seen a decline in the available blood supply out there. And it really now is getting to a point where frequently we are getting very, very low on the supply of blood available to us.
So then what do you do when you need the blood? And God forbid there's a mass casualty situation where suddenly you're going to need a lot of blood.
Mm-hmm. Yeah, if we had a situation like that, obviously, we would just have to try to reach out to communities away from us and try to get other resources to give us blood in an emergency situation like that. It's really more worrisome on kind of the day-to-day basis where we don't have to have a mass casualty situation, but if we happen to have one or two cases or two or three cases where there's unexpected blood loss and so on, we could suddenly find ourselves in a shortage situation where we really don't have a lot of blood available to help out. So it is really critical that we try to reinvigorate the blood donation process, because there is no other avenue for us really to solve this. It isn't something unique to the Coachella Valley. This is true really even nationwide and certainly regionally, that everyone is struggling to maintain an adequate blood supply out there. So our hope is that we can really get that message across to the public that it is absolutely critical that we donate blood on a regular basis whenever we can, so that we keep that blood supply available when we need it.
How does the process work? Do hospitals go through LifeStream first?
Yeah, everyone has to contract with suppliers. The days where individual blood banks in hospitals existed and so on are long gone. There's centralized organizations who are able to maximize the benefit that we can get from donation, and so each hospital contracts with some regional supplier of blood. So in our case, yes, LifeStream, working with them just to put in our order. This is how many units of blood we think we need in order to have our shelves stocked adequately. And, as you said at the outset of the interview, they're finding it difficult now to meet those requests.
So I hate to go back to the mass casualty scenario, but if there is a situation where suddenly all the hospitals in our valley, not just Eisenhower, need blood and LifeStream can't supply that, what then? Do you compete with, for example, Desert Regional to get blood from outside sources? How does that work?
Well, really, we would all try to work collegially and collaboratively with an organization like LifeStream, who would then, they too would go out and try to reach out to other regional suppliers of blood to say, hey, we had a mass casualty situation in the Coachella Valley. We need hundreds of units of blood, and we'd reach out to Los Angeles, San Diego, et cetera, to try to find other areas that could help us meet that acute demand for blood. But I'm really more concerned on a day-to-day basis. We get into situations, fortunately, we've been very lucky and very careful in managing our blood supply so that we've not had to do a lot of canceling of surgery. We've had a couple of occasions, I think maybe 2 occasions over the last 6 months, where we did have to delay some cardiac surgery procedures because of a concern that we were getting too low on the blood supply supply, and that's a type of case where you can potentially get into a situation where you may need 4 or 5 units of blood. And if we were getting too close to that kind of a level, then we thought it best to delay surgery. So I'm really more concerned about over time a situation where we may see that becoming more and more of a problem, where we have to start canceling or postponing surgeries because we really don't have a backup supply of blood available if we need it.
Dr. Williamson, as always, we appreciate your time. Thanks so much for joining us.
Thank you, Peter.